Madam Chair?
Yes, please.
Okay. Um, First of all, I really want to stress action. I've been here for a long time, and I been through a lot of shutdowns, but I do not remember any shutdown where the members of the House of Representatives or the Senate didn't stay here in Washington Saturday, Sunday, the whole time
Yep.
until we had figured out on a bipartisan way how to end the shutdown. And the fact that the House Speaker canceled votes last week, canceled votes this week, so that we don't even have the opportunity to be here in session to vote on some negotiated bipartisan agreement to end this crisis is an outrage. It is totally an outrage. And for those who are suggesting that somehow there's no reason for us to be here because we can just vote on one proposal versus another is not an excuse. It is certainly not an excuse. The other thing too that I see is that our Republican colleagues in the House won't acknowledge that there is a healthcare crisis. When I say to them, "Oh, there's a crisis," they deny that it even exists. They refuse to show up to fix it. They say it doesn't exist, and they don't see the urgency of it. Well, let me tell you that we don't have any time, right? I mean, already in many states, they have put out the filings and indicated to the public what the next premiums are going to be without the help from the federal government that comes from the subsidies or the tax credits. What I'm hearing from my colleagues on the Republican side on the Energy and Commerce Committee, where I'm the ranking member, they say, well, we never supported the Affordable Care Act from the beginning. We never supported the enhanced premium tax credits. So why would you expect that we would care? Why would you expect that this matters to us? Now, I understand they didn't support it. I was one of the drafters of the Affordable Care Act when I was the chairman of the Health Subcommittee of Energy Commerce at the time. I understand they didn't support it. I understand that they tried to repeal it. I understand they didn't vote for the enhanced premium tax credits. But for them to not understand why that's important, and having been, through COVID and so many crises, and realizing that healthcare premiums keep going up, the deductibles, the copays keep going up, and that this is a crisis, you have to be an ostrich. You have to have your head in the sand. You couldn't possibly not understand that or not care. But this is what we're hearing from them right now. November 1st, a lot of the filings are already out. November 1st is when the open enrollment begins for the marketplace, for the Obamacare or the ACA marketplace. So within the next few weeks, people are going to have to make a decisions whether or not they're, buy the insurance or not. And it's probably about 25 million Americans are going to face the sticker shock or the skyrocketing monthly premiums that come from the fact that they're not providing or not helping provide any, these extra tax credits that make a difference. Now, I just want to give you an example. I'm going to so many, and I've been here sitting here with you for a while, and I've heard some examples, but I wanted to just use one example of a 60-year-old couple making $85,000 a year in Fulton County, Georgia, that'll face a increase of more than $2,000 per month in January. You're making $85,000 a year, and you're going to buy insurance that is going to cost you $2,000 more per month. You're not going to do that. You're just going to go without the insurance. And what happens when you go without insurance? The costs for everybody else go up, right? You don't have insurance, you have you go to the hospital, uncompensated care. The hospital then doesn't have that money coming in. So they're going to increase premiums for everybody. This isn't just for people who are get their insurance through the marketplace. This includes those 65% of the public that get their insurance through the job, because all those providers, whether it's the doctor, whether it's the hospital, whether it's a nursing home, they're all going to have to spread those costs to people that have insurance through their jobs, right? And that could go up 10%, 20%, who knows, because of the uncompensated care. And then the next thing's going to happen. A lot of those employers are going to say, well, I can't afford to buy the health insurance for my employees anymore. Or I'm going to buy a policy that's catastrophic, that doesn't cover anything, or increases the deductible, or increases the copays. So, you know, some people are saying, well, what does it matter? This only applies to the people, you know, that buy their insurance through Obamacare. Most people get their insurance through the job. That is another false narrative. That is another lie that is being put out by the Republicans, because everybody is impacted by this. And you understand that this crisis has been aggravated by the fact that when they passed their big ugly bill or big beautiful bill, whatever they said, right? Not only did they not provide for the enhanced premium tax credits that we're now talking about, but they also cut Medicaid by $1 trillion. And the result of it is there's also going to be cuts to Medicare by 4% across the board because of the sequestration. I don't like to use that term with my constituents, but you know what I'm talking about, right? That's another $500 billion.
Right.
And all these things have created a crisis. But beyond that, this administration has created a healthcare crisis that goes even beyond Medicare, Medicaid, and health insurance in general, because you have a Secretary of Health and Human Services, Robert Kennedy Jr., who's telling people they don't need vaccines or making it more difficult for them to get vaccines. I have people calling me at my district office asking me whether they should take Tylenol. I mean, I've been dealing with healthcare for a long time, but I'm not a physician. I'm not going to tell them whether they should take Tylenol, but they have created all this chaos, not only with health insurance and vaccines, with what kind of medication you should take. It is just unbelievable. And the other thing is the shutdown. And that's the last thing I'm going to mention, is that this shutdown aggravates all of that as well. They're like, you know, you understand this. Some of these community health centers, other places that rely on funding diabetes programs, teaching health centers, telehealth, all of these are depending on federal dollars. And some of them keep going now because they have a little more money for another week or two. But this Republican shutdown is also aggravating the Republican healthcare crisis, because these places are going to run out of money. And then what happens then? More uncompensated care, more people going to the emergency room. And as a result, premiums go up again, even for people in the private sector. So it is totally irresponsible for them to say that there's not a healthcare crisis, that people do not need the help of the federal government to pay for the health insurance on their ACA. It's time for the Republicans to get back to work. Come down here and meet with us. We're here, they're not. I think that shows a lot about the fact that we care and they don't. And thank you for having this hearing.
Thank you so much, Congressman Pallone. Congresswoman Christy Houlihan of Pennsylvania.
Thank you so much for the opportunity to speak in front of the committee today. My name is Representative Chrissy Houlihan, and I serve Pennsylvania's 6th Congressional District, which is just outside of Philadelphia. And it's not that far. In fact, I left home this morning at about 5 a.m. to be able to come down here, and intend to be here for the remainder of the week, and I'll be here next week as well. For 8 days now, we have invited President Donald Trump and Speaker Mike Johnson to work with us to forge bipartisan deals that will reopen our government and will lower the cost of health care for millions. But where are the House Republicans? When you walk around the halls, they are nowhere to be found, and it's apparent that they are on an extended vacation. Where I have had a town hall and 4 different roundtables over the last 2 days, I'm not certain that any of our Republican colleagues are doing anything to advance our government or the people that they represent. I am one of the most bipartisan members of Congress. I'm on the Problem Solvers. I'm part of a group called For Country, which is all about people who've worn the uniform. I'm the co-chair of the Bipartisan Climate Caucus, the Bipartisan Biotech co-chair and founder. I'm the Bipartisan STEM and STEAM co-founder. I am the Bipartisan Service Member co-founder. You would have to look very hard to find somebody who's less or who's more bipartisan than I am. And I stand here willing, as usual, to work with any Republican who wants to do the right thing and to protect access to health care. I come from one of the most bipartisan communities in Congress. My district is 40% Republican, 40% Democrat, and 20% independent. And let me read to you the top 3 and 4 reasons why people have been calling my office during this shutdown. Number 1, they're worried about the end of the ACA tax benefits. Number 2, the deployment of U.S. troops. Number 3, the behavior of ICE. That's how emails are, the top 3. On voicemails, number 1, the fear of losing their affordable health care. Number 2, the deployment of our guard to cities, American cities. And number 3, to please swear in Representative Gahalva so that we can have a vote on the Epstein files. From my community of 40% Republican, 40% Democrat, and 20% independent, those are the top 3 reasons that people are calling my office. You notice that not one of them says bend and open the government again. Not one of the top 3 reasons. So again, I ask, where are my Republican colleagues? Surely the silence from them is deafening. And the result is that, as you've seen, people from southeastern Pennsylvania, both Democrats and Republicans, are scared. They're scared that they may be one of the tens of thousands of people who will see their health care costs rise because of the Republican budget, known as One Big Beautiful Bill. They're scared that over 19,000 people will lose health care coverage because of the Republican cuts to Medicaid and the Republican refusal to extend the health care tax credit. And let me be clear, this is a problem of their making. We all want the government to open and to be functioning, but we cannot walk away from healthcare for 24 million Americans. And in my district, I hear consistently that life is very unaffordable, how costs are too high and healthcare is out of reach. And we've seen firsthand what happens when inflation and a lack of access to care can meet. We've faced 3 hospital closures in my community alone already. We've seen too many healthcare systems struggle with rising costs, the low in reimbursement, and provider shortages. And here is where I believe that we must hold the line, because there's too much at stake for too many. If Republicans don't join us, join me, and act now, my community will certainly suffer, and so will theirs. Illness doesn't affect just one party. If you're diagnosed with breast cancer, it doesn't matter if you're a Republican or a Democrat or an independent. If a family member needs insulin, no one cares who you voted for. What unites us as Americans is that we all know someone who will face health challenges or may in fact be facing them ourselves. So I implore my colleagues across the aisle, please remember that. Please come and join us here in Washington. I remain willing to meet anywhere and anytime to negotiate a bipartisan government funding agreement that will protect people's health. Thank you so much for the chance to address the committee, and I yield.
Thank you, Congresswoman Houlihan. Congresswoman Andrea Salinas of Oregon.
Thank you, Chair Wasserman Schultz, and to the committee for the opportunity today. So President Trump and congressional Republicans refuse to cancel the healthcare cuts to millions of Americans, including the 16,000 in my district who are about to pay hundreds, if not thousands of dollars more per month for their health insurance. And similar to Representative Houlihan, my district is about a third urban, a third suburban, and a third rural. And this is important because about 27% of farmers across the United States get their health care through the Affordable Care Act. And so I see this as one of the biggest betrayals to Americans' rural communities. I recently sent out a survey to my constituents, and I'd like to share just a couple of the stories. First is a story from Steve, who lives in his with his wife in Beaverton, Oregon. Steve is 68 and still working. He's on Medicare. His wife, however, is only 61, and she won't qualify for Medicare for a few years. She currently pays $500 a month for coverage through the Affordable Care Act, but next year her premium is set to increase to $800 per month unless Congress acts.
No, I'm okay.
In his response, Steve notes that his wife is a waitress at a small locally owned restaurant. So an additional $300 per month is just simply too much on top of what they already pay for her health care. They likely won't be able to absorb that additional $3,600 a year in healthcare costs, and they will likely just not renew her health insurance and be forced to go without it. Another one of my constituents, Connie, responded with a similar story. She's from a place called Dallas. It's a small rural town in my district, and she has a bronze Affordable Care Act plan, which means her coverage really only covers serious injuries. Everything else she pays for out of pocket. She recently received a letter, one of those notices in the mail, telling her that her premium is going up. Right now, she pays $423 per month for her healthcare premium. Next year, due to Republicans' refusal to work, not just work with Democrats, but to come to work to extend the premium tax credits, she will pay a staggering $2,273 per month. That's an increase of over $1,800 per month in a small rural town in my district. And I don't know about you, but I don't know many people in my district or in Oregon who can afford that extra $1,800 per month for healthcare. These are just 2 stories from over what I expect to be about 16,000 people in my district. And obviously, we've been talking about millions more that we are going to see across America who will see their premiums spike unless Congress acts. I'm truly worried about Connie and Steve and his wife. I'm worried about all these people who will be impacted in my district and across the United States, and so many more. I don't know how they'll get the care they need if their costs go up next year. I don't know how we will be impacted in our rural healthcare clinics, in our senior living facilities. I don't know how we are going to help them, but I know how we can stop it from happening. Republicans can come back to the negotiating table. They can cancel their cuts to healthcare, extend the premium tax credits, lower costs for families, save healthcare, help Oregonians, reopen the government. Let's start there.
Thank you all so much.
Thank you. I yield back.
Thank you very much. Thank you for sharing those very personal stories. Just another example of how important it is that we underscore the real impact on real people, which is going to cause real pain. Thank you to our panelists as they may make their way out. I'll call upon Congresswoman Hillary Skolton, Congresswoman Melanie Stansberry, and Congressman Don Beyer to the table. And as soon as you get settled, you are recognized.
Thank you so much, Madam Chair. And I want to thank the Steering and Policy Committee for convening this meeting, although I would much rather be on the floor of the House voting on some sort of new deal regarding healthcare. I just think that where we are is sort of unsustainable. People always ask me, how is this, what impact is all of this having on your constituents? And as I listen to people come up with different numbers, so, you know, my constituent is going to be impacted this way or that way. I just want to clarify for the record that we are all in a panic because what we don't know is how much people's healthcare premiums will go up in individual states and different situations. But what we know is that everybody's healthcare premiums are going to go up. That's what we know. And to the extent that people have to add additional healthcare costs to their already strained budgets, with the rent being too damn high, and with the inflation from the cost of groceries, the last thing that they can afford is their healthcare premiums to go up. I hail from the state of Wisconsin, a state that did not expand the Affordable Care Act. And so my numbers may sound a little bit different from what other people's numbers are. But I just have stories from some constituents who have called our office and they're very concerned. One of the things that the Affordable Care Act did is that it broke the job lock that people were in. People were unable to move to a different job, and they were unable to become entrepreneurs. So if you're that photographer out there who's working for J.C. Penney, and you decided that you were just good enough to go out on your own and to do the bar mitzvahs and the bat mitzvahs and the weddings on your own, the one thing that you couldn't afford was health care. And the ACA enabled you to be able to do that. So Jeffrey from Milwaukee, he says he's self-employed and he completely counts on these credits in order to afford his health insurance. And without that, he would be uninsured. The anxiety that I and I am sure others are feeling is the same. So that is the signature feeling that people have as we have insurance companies about to send out, as we speak, their letters announcing the premium increases, the anxiety that Jeffrey, as an example, is being felt. Another person from Milwaukee, Erica, she retired this year, and she was using the Affordable Care Act for her and her college-age daughter. She benefited from the ACA credits, and the credits allowed her to afford the insurance. Because of her income, she did not have to pay a monthly premium, but she and her daughter both had a $6,700 deductible based on their plan. Should the subsidies end, she'll be responsible for $1,000 for herself a month and $1,000 a month for her daughter, and still subjected to the $6,700 deductible per person. She's 55 years old, 10 more years before she'll be covered by Medicare, and she is just terrified. How will she be able to afford $2,000 a month healthcare premiums, going from $0 to $2,400 a year? 24,000, I'm sorry. And she just doesn't have the budget for that. Another person, Robert from Milwaukee, he was on Medicaid, and he was one of the people that heard the pleas and heard the demands that you get up off your lazy butt and go to work, or what, make more money. So he earned just $200 over the poverty level, kicked off Medicaid, and so now he has no health care whatsoever. But he was so lucky that he found a plan on the marketplace that met his needs. He said that he could afford a silver plan because the $900 a month premium was reimbursed through the Affordable Care Act. And now he is saying that he's at risk of not having any health care at all. He is an in-home senior caregiver working part-time so he can take care of his aging parents. These are the calls that I'm getting. Dennis, same thing, in his early 60s. And he says he's staring into a chasm of fear. And he said, for thousands of Americans like me, word for word, the ACA is not a political talking point. It is the wall between a bearable, if difficult, life and complete and financial and medical ruin. I relied on the ACA's marketplace for my health coverage, and the only way I could secure a policy that didn't deny me for my age, that capped my out-of-pocket costs, and that allowed me to maintain my own health. So he said the fear is a cold, suffocating blanket, another constituent whose wife has cancer. So in the interest of time, I just want to submit the rest of my testimony for the record, Madam Chairwoman. But people ask me how my constituents are doing. I have 267,000 constituents at a minimum. That's just at a minimum, who are going to lose health care as early as the end of this year because we are not expanding these health care premiums. And I just want to remind the panel, Madam Chair, that the Medicaid cuts of $1 trillion, these were not, as they have been characterized, for lazy incels that are sitting in their basement playing video games and calling up the basement steps, telling mama to bring them some more potato chips. 46% of Medicaid funding is spent on seniors in nursing homes. And that's a mandatory thing that has to be funded. So the other the other 54% are going to, we're going to face major cuts in terms of allowing people to stay at home to get health care, allowing them to have rides to dialysis. We are really putting people behind the 8 ball. And with that, I would yield back, Madam Chairwoman.
Spoken like a seasoned member of the Ways and Means Committee. Thank you very much, Congresswoman Moore. Congressman Don Beyer from Virginia.
Well, first, Madam Chair and Chair Wasserman Schultz, Chairman Barragan, thank you very much for doing this. I really appreciate it. And everybody who came from all over the country to be here. And I have the great honor of sitting next to Congresswoman Moore on the Ways and Means Committee. It's a great time. And next to
Chop liver
Congressman
over there.
Boyle when he is not otherwise occupied with his leadership of the Budget Committee. And his chair bangs into mine. But I'm so glad you're doing this. I just want to make 5 simple points. But before that, just the overall theme is how morally unacceptable this is. That life, liberty, and the pursuit of happiness are not possible when we don't have health care, when we're sick, when we feel bad, when we die young. And they are undermining the American commitment to our Constitution, to the Declaration of Independence. Point number 1, I held 2 Medicaid roundtables earlier this year. The message that jumped out from both were the parents and the grandparents of children with disabilities, often grown children with disabilities, 22-year-olds, 28-year-olds, who are only able to take care of them because of the Medicaid waiver. Tears, great fear, great anxiety. What's going to happen to these kids when the Medicaid waiver goes away? When you cut $1 trillion out of Medicaid, which is what the Republican bill does, this is inevitable. And it's going to have a really bad impact on all those people that have disabilities, whether they're physical, sensory, or intellectual disabilities. Number 2, with Andrea Salinas, who's just on here, she and I co-chair the Mental Health Caucus, taking over from the wonderful Grace Napolitano. What I'm hearing from the psychiatrists and the psychologists and the MSWs is great fear about what happens with Medicaid, with all the folks with severe mental illness, and just with anxiety and depression, the people who won't be able to go to work. And then point 3, that's just the fact, politically, I do not understand what the Republicans are doing. The only reason Donald Trump, well, there's many reasons Donald Trump won, throwing some racism, throwing some misogyny, but the political issue, the policy issue was the cost of living that has skyrocketed during the 4 years of COVID.
Next is Stan.
And so his big
McLean.
promise for the golden age of America and to cut costs, he's not done a single thing this year that would bring those costs down. This is probably the worst. It's even worse than the tariffs in terms of driving costs up. It's going to drive costs up for all those people that are depending on the enhanced premium tax credits, but also for everyone else. Because I'm a member of Congress, I'm on the exchange, Washington, D.C. I don't appreciate the fact that it's age-related, but what the hell? It's very expensive for a couple of 2. But I don't qualify for the credits, of course, but because of the credits and not doing the premiums, not only will many millions of people lose their health insurance, but the ones who won't sign up again because they can't afford it are typically going to be the healthier ones. And the ones that stay on are going to be 75 years old. And you're going to have what they call adverse selection that you all know about very well. That means the premiums are going to go up for all the people that still are on it. So everyone's premiums are going to go up, whether they got the credits or not. The 4th point, also, I'm just astonished that on the one hand, you have John Thune in the Senate saying, we'll just take care of it later. Others have spoken eloquently about, oh yeah, we can trust them. And then you have the Freedom Caucus and Andy Harris and others saying, let's just get rid of them once and for all. Literally just a commitment to no health insurance. Point 4, I spent 46 years running the little family business. I promise you, when I would look at the financial statement every month, one of the things that was the most difficult to deal with was the cost of healthcare. And if you're a good boss, you're paying for the healthcare premiums for your employees. And if not paying for all their families, you're at least subsidizing it. This makes it ever harder for people to be entrepreneurs, to start a business, to grow a business, to survive in this economy. This is the absolute opposite of what you want to do if you want to grow this economy faster. And finally, because none of my Virginia Republican rural friends would show up, let me point out that 3 hospitals have already announced closing in rural Virginia in the Shenandoah Valley. It's going to hit the people that voted for Donald Trump harder than anybody else.
Yep.
And it is a crazy thing politically to do. You know, and why, for people who are supposed to be thinking ahead, would they want to give us the most powerful political message of what they've done to their people in the 2026 elections? If I were a Republican, I'd be begging Toon and Johnson to solve this. I'd actually, like Jasmine Crockett, be endorsing something Marjorie Taylor Greene for the first time in my life, that they need to step up and fix this. And with that, I thank you for doing this. I'm pleased to yield back.
So much, Congressman Byer. Congresswoman Hillary Scholten of Michigan.
Thank you so much, Madam Chair. Can you all hear me?
Yeah.
Speaking okay? Fantastic. And thank you to my esteemed panelists. I appreciate your remarks and insights so much. Today marks day 8 of this shutdown, 8 days since Republicans brought this government to a grinding halt, all because they refuse to address the affordability of healthcare in this country. We are here, ready to get to work. We were supposed to be voting this week, but the Republicans canceled votes and gave themselves a taxpayer-funded vacation while we continue to work. Our troops are about to miss their first paycheck if we don't get this resolved. Federal workers are working without the certainty of a paycheck. Republicans in Congress will still get paid while this shutdown goes on. And they gave themselves a vacation funded by the taxpayers rather than showing up here to do their work. The deadline to pass a budget, I'm new to Congress, but I'm told it's the same every single year. September 30th, I see heads nodding from our esteemed panelists. This is not a surprise. Is it, Ranking Member DeLauro? We do this every single year, September 30th. We know the deadline. I'm told we're ready to go on our side. We've got our ducks in a row. We know what we want, but they have been disorganized to the detriment of the American people. They're using this moment for political leverage. They had no problem passing tax cuts and making them permanent for billionaires earlier this year, even calling us back from the 4th of July holiday to make sure that those tax cuts for billionaires could get through. But they won't even come to the table to negotiate tax cuts for hardworking middle-class families that would allow them to afford the health care that they need. I've heard a lot of bluster from our Republican colleagues talking about how we should just go along and pass this clean CR so that we can get it done. We're not even going to negotiate over whether this is a clean CR. It cuts $13 billion in non-defense discretionary funding, including almost $280 million to the NIH, on top of what has already been cut. I urge my Republican colleagues to come to my district and talk to family members who have loved ones in clinical trials for rare disease by the NIH and say, sorry, your study was cut. It was a clean CR. What can I tell you? That's not the way this works. It's not a clean CR. The American people are asking us to stand up for affordable health care. I want to share with you the story of some constituents who are directly impacted by this funding. When people ask, can't Democrats just go along and vote for this continuing resolution? These are the reasons why we can't. Because of the American people, because of our constituents like Amanda and Adam in my district, a real constituent from Grand Rapids. She writes in, my partner, Adam, was diagnosed with a rare form of cancer 3 years ago. As you can imagine, this completely upended our day-to-day lives. It's especially rare for such a young person to receive this diagnosis. We connected with specialists. Due to the rare nature of the disease, Adam ultimately decided to pursue his medical oncology at the Mayo Clinic in Rochester, Minnesota, and his surgical oncology at the National Institutes of Health in Bethesda, Maryland. We were somewhat aware of NIH, but had no idea what an amazing institution it is, covering the cost of care and even the cost of travel, all in the service of research advancement and public health. He's also benefited from NIH funding through the Mayo Clinic via an NIH-backed clinical trial he participated in at the beginning of his journey. He and I have literally lived at the NIH campus while Adam underwent 5 separate surgeries and recoveries in the span of 3 years. The longest surgery of which was approximately 16 hours long and required 2 weeks in a clinical center to recover. Without exaggeration, my husband may not be alive today without his care team at the NIH. He's currently doing well and considered to be NED, no evidence of disease. But the statistics for his cancer are grim, and we are not naive to the possibility of it returning. We are horrified that NIH and our nation's public health have been infiltrated and put at risk by political interest. No one wins in this dystopian situation. We need to protect the world-leading work of NIH and the entire HHS. As NIH is gutted, it leaves us with fewer options should Adam's cancer return in the future. I live by the mantra that I am always willing to compromise, but not compromise my values. We are here because we're willing to come up with a compromise that funds our government, but not willing to compromise on our values of protecting healthcare for the American people. Thank you. I yield back.
Thank you so much, Congresswoman Skolton, Congressman Byer, Congresswoman Moore, classmate. We appreciate your advocacy on behalf of your constituents and the American people. And as you make your way from the table, I will ask Congresswoman Melanie Stansberry of New Mexico, Congresswoman April McLean Delaney of Maryland, and Congressman Steny Hoyer, our former whip and majority leader, to come to the table. And in order of seniority, as he takes his seat, I will recognize the gentleman from Maryland, Mr. Hoyer, for his opening remarks.
Is it on? Okay. That, in my view, is why we're here. A lot of Marylanders are anxious, worried, and in many cases fearful that they and their families will either lose their health insurance or won't be able to afford the coverage they've had. You've heard many instances of that being the case. 190,000 of them will see their monthly health care premiums skyrocket by an average of 68%. That's in the small state of Maryland. Another 110,000 of them will see an average increase of 17%. Some 181,000 Marylanders are at risk of losing coverage altogether because of Republicans' manufactured healthcare crisis. Extending these tax credits is not an abstract issue for Marylanders. It will determine whether they have to ration their medication or face bankrupting costs. It will determine whether they can keep food on the table and a roof over their heads. Marylanders cannot afford to look away. Sadly, House Republicans are away. For the second week in a row, they are nowhere to be found. They could have worked with Democrats to protect the health of the American people. They could have worked with us to keep the government open. Instead, they are absent without leave. Although I suppose the speaker would say he gave them leave. They left the American people on the tracks, and the train is now coming. The time to act is now. Premiums are at hand. The loss of coverage is fast approaching. The urgency for action is now. Not November, not December, not a CR to March 15th, as happened last year, but now. The only way to avert the healthcare catastrophe that is about to befall the American people is for Republicans to do what democracy demands: work across the aisle to create consensus. Instead, they turn their backs on consensus. The same person I quoted, Russell Vogt, was quoted just a few weeks ago that there ought to be less bipartisanship in the Congress. Let me repeat that. There ought to be less bipartisanship in the Congress. They heed the direction of Director Vogt to have less bipartisanship, not more. That is the exact opposite of what the American people ask all of us to do. Republicans continue to leave Americans waiting. Americans are still waiting on Republicans to lower cost, something Trump promised to do. Americans are still waiting for Republicans to make America healthy again. Rather, they abandon them on their health care. Americans are still waiting on Republicans to govern. Now, committee, I would like to call your attention to, because there's a lot of talk about who's responsible for this. Ronald Reagan was president when I came to the Congress of the United States. In the 8 years that he was president of the United States, there were some 8 shutdowns. One year he didn't have 7 he had. And I want to tell you how long they lasted. 1982, 1 day. 1983, 3 days. 1983, 3 days. 1984, 1 day. 1986, 1 day. 1987, 1 day. Why were they so brief? We controlled the House. The Democrats controlled the House. Ronald Reagan was president of the United States, and the Republicans controlled the United States Senate. It was because we all believed shutting down government was a stupid, harmful, and expensive policy for all America, not just federal employees, but all those whom they serve every day, answering phones on Social Security, helping veterans get their health care, doing the things that government does for our people. So it's shutting down America that we're really talking about. And the reason they lasted 1 and yes, 3 days, which by the way was over a weekend, was because each of the parties, the Republican president, the Republican Senate, and the Democratic House were willing to talk, were willing to compromise, were willing to bring this crisis to a quick close. How we all hope that we will learn that lesson from Ronald Reagan, from the Republican Senate and the Democratic House for those 8 years. Come back, Republicans. America needs you. Thank you so much, Madam Chair.
Thank you, Congressman Hoyer. Next, Congresswoman Melanie Stansberry of New Mexico.
Thank you, Madam Chair. Colleagues, thank you for being in Washington, D.C. to do your jobs. Thank you for flying across the country, leaving your families, coming back to Washington to show up for the American people, American democracy, for common decency and basic human dignity. We're here today to say, reopen the House, reopen the government, fix American healthcare, and do your jobs. Now, this fight is personal for me. Like so many New Mexicans, I grew up in a low-income family with a single mom who was self-employed. We didn't have health insurance until I was an adult. And yesterday was the 2-year anniversary of my mother's death. After she survived 15 years with a brain tumor, discovered before the passage of the Affordable Care Act. A life-saving MRI and credit card debt that not only saved her life, but enabled her to live with dignity. That put her thousands of dollars in debt and saddled my mother for the rest of her life with the prospects of having to decide whether or not to pay for housing, food, healthcare, and basic necessities because we had failed to act as a country until we passed the Affordable Care Act. If we do not fix healthcare, people will die. People will lose their healthcare. Now, this may not matter to Mr. Mike Johnson and the billionaires that they're serving, because it doesn't matter to them if it costs a few $100s extra a month for them to pay for their health care. But let me tell you, for people like my mother, for people like me, for people like New Mexicans across the state and millions of Americans across this country, it will mean the difference between putting a roof on their head and being able to put food on the table. It will mean the difference between ensuring their families and their children and saving their lives and making sure that they have access to health care. And so while I understand that my colleagues across the aisle think that this is some sort of game, that they think they can just shut down the House and stop showing up for work and not come to Washington, D.C., that they can just tell the American people to eat these costs and tell Democrats that they don't have to negotiate. This is literally life or death for millions of Americans. So what we're here today to say to our colleagues across the aisle and to Mike Johnson is do your job. Come back to Washington, D.C. and negotiate in good faith, because this is a matter of life and death for millions of Americans. And this is not a game, sir. This is not a game. This is American lives. And these stories are not hypotheticals. These are real people. In New Mexico last week, our state legislature under Democratic control, our Democratic governor, Michelle Lujan Grisham, who served in this great body, and our Democratic legislature said, we are not going to let New Mexicans starve and go without health care. And so they ponied up, they held a special session, and they put tens of millions of dollars on the table to make sure that New Mexicans are okay for the next several months. But there are 49 other states that have not yet acted. There are millions of Americans that will go without health care and without assistance if we do not act. And so that is why we are here. That is why we showed up. That is why we are calling on our Republican colleagues to get back to Washington. That is why we are asking to reopen the House, to see Adelita Grijalva, to pay our federal workers and our troops, to save our health care, and do your damn jobs. Get back here. This is about basic human decency and the commitment to the oath you took. So, Mr. Speaker, we ask you, come back. And with that, I yield back.
Much. Thank you for sharing that deeply personal story, Congresswoman Stansberry. Last, but certainly not least, one of our newest members, Congresswoman April McLean Delaney from the great state of Maryland.
Can you hear me? No. How about that? Okay, great. I have to say, Congresswoman Stansberry's very emotional plea for our colleagues to come back and to sit on the other side, Steny Hoyer, who leads up the senior House member of my great state of Maryland. But it's about values. And I just have to say thank you to our Democratic caucus for showing up to care, that we care about people and who we are as Americans and what we stand for and what health and well-being for everyone means in this country. And I so appreciate your stories and what that means, because those are echoed across every district and every state in this country. So I represent Maryland's 6th congressional district, and I call it a microcosm in miniature of America. Red, blue, suburban, urban, rural, 5 national parks, 35,000 government employees, loyal employees, civil servants who show up each and every day, irrespective of party, just to serve. And the tsunami of cuts that is hitting our residents, including these public servants who might now see a loss of health care, is staggering. And by way of data, as of 2024, 21,000 people in Maryland 6 received tax credits in the ACA to lower their premiums, and up to 9,000 families are projected to lose their health coverage. A family of 4 making $64,000 a year in Maryland would see their premiums decrease 200%. Those are statistics, but there's also stories. But first, I have to say, this week, none of us wanted to be in a government shutdown, and our Democratic colleagues worked hard to avert it. As Steny Hoyer said, it is our fiduciary duty, and we've had limited government shutdowns in past administrations because it's not good for the American people. Having said that, and I was on a teletown hall last night with 15,000 people calling in, many of them about healthcare. Some things are so important, they're worth fighting for, like standing up for our health and well-being for Maryland and all of America, and making sure that we don't sign off on a budget that makes life less affordable and harder. And where are missing Republican colleagues waiting for the president's approval to show up? They're home. They're home. But we're here doing our job. And as my husband John and I often say, you can't fake showing up. And we're showing up. So last week, I was with the Women's Democratic Caucus, and they came out and toured with our local officials in Maryland, in Germantown, the Up County Regional Health Center, a one-stop shop for our neediest residents, from dental and maternal health to Medicaid and SNAP benefits. This is an essential lifeline for many of our most vulnerable. And these type of facilities provide both state and, most importantly, federal assistance, which is stable and reliable. That tour reinforced my view, and many who were there, that healthcare is not a talking point. As I said, it's a lifeline. And when federal funding for Medicaid and critical services is cut, the impact is staggeringly real. Across the 6th, 1 in 7 families depend on Medicaid, and statewide, more than 247,000 Marylanders are enrolled in the ACA marketplace coverage. I think that was put forth by Steny Hoyer. Nearly 9 in 10 of them depend on premium tax credits to keep it affordable. And without those credits, families in my districts will see premiums rise by hundreds or thousands a month. Last week, on the Capitol steps, I met Tony, a father with a young family. He's undergoing chemo for his aggressive cancer. He personally stated to me, after his public comments, that without the ACA tax credits, his premiums would double, and he truly was afraid that he would not be able to continue his treatments, and thus he would not be able to continue to live. These are not statistics. They are true impacts on families. But for Western Maryland, which is rural, Maryland's rural hospitals and clinics really could be forced to close medical wards, maternity wards, cut mental health facilities and addiction programs, or just shut down entirely. And the tsunami of cuts hitting our states on multiple fronts, they can simply not fill the gap. That is unacceptable to me, because I don't want our mothers in Garrett County to be left without maternal care. And I definitely don't want our seniors in Allegheny, which they've talked to me a lot about, to be forced to drive 3 to 4 hours to receive critical medical treatments. So I've traveled in the last 2 weeks across Garrett, Allegheny, and Frederick counties, and Washington County as well. And they all say that they are worried in rural America about people falling off of Medicaid and the uninsured rushing their emergency rooms. I repeat, hospitals could close. And for instance, some of these hospitals have 60% of their patients on Medicaid. Last, I'm the only Marylander on the House Agricultural Committee. Farmers are already under economic duress from tariffs and economic uncertainty and loss of SNAP. They're also really stressed about healthcare. Half of the women in America deliver on Medicaid. But those communities also encompass farmers who are in essence small businesses, and many of these utilize ACA credits. It's estimated nationally that 27% of our farming families, many of them who are older, rely on the ACA tax credits. This was mentioned several times last night at my town hall. And then my final point, I'm going to say, this GOP-driven shutdown is hurting Maryland and states in other ways. Not only federal workers without paychecks and small businesses and farmers caught up in economic uncertainty, weird sombrero memes and grim reaper memes aside, this administration's authoritarian actions have targeted our federal agencies, NIH cancer trials, and the withholding of emergency FEMA funding and the rescission of federal grants for infrastructure and energy projects. These actions too hurt the health of our state and of our working families and our dedicated civil servants. And they also undermined our national security and most importantly, trust in our government. So let me be clear. We cannot let the health and well-being of our citizens, of our state, or of our country to be held hostage to partisanship, retribution, and these cruel-hearted cuts. And I will work in a bipartisan way to end this shutdown. But I have to stay united with my Democratic colleagues, as well as my state, in the fight to extend ACA credits, to protect Medicaid, and to lower the cost for all Americans. Wes Moore, our governor, often says, we leave no one behind in Maryland, and we in our Democratic caucus cannot afford to leave any Americans behind either. Thank you.
Thank you, Congresswoman McLean Delaney, Stansberry, and Hoyer. And as you make your way from the table, we'll ask Congresswoman Joyce Beatty of Ohio, Congressman Stephen Horsford of Nevada, and Speaker Emerita Nancy Pelosi from California. A powerhouse panel.
That's right.
Minus Horsford. I think it goes without saying that I would recognize Speaker Emerita Nancy Pelosi for her opening remarks.
Thank you very much, Madam Chair, and thank you to the Steering and Policy Committee for the excellent work that you do, policy and steering in our caucus and in the Congress. It's an honor to be here with Joyce Beatty and Steve Horsford and with all of you. I see Congresswoman DeLauro, a former chair of the Steering and Policy Committee for many years, also of the Appropriations Committee, having such a hand in this legislation that we're fighting in terms of getting health care permanent for our people. Let me just, I saw that members put their remarks. I have my remarks. We had a press conference the other day in San Francisco with with Jared Hoffman and with Kevin Mullen, two members who butt the district that I have the privilege of serving in San Francisco. And we had people come tell their stories, and one of them gave me permission to further bring the story here today. But before I do, just to say a couple of things, because I see that others have placed their story in perspective. Here we are at a place that I think is very critical for our country. Those in the White House and on the other side of the aisle have done nothing in their time but except to undermine the Affordable Care Act. Not only that, in the 90s, put Medicaid in a box, tie it in a ribbon, they're ready to throw it in the deep blue sea. They said, and some of you remember, Betty, you do remember when they said, Medicare should wither on the vine. Again, scores of times that others of you participated in when they tried to eliminate the Affordable Care Act, repeal the Affordable Care Act. So they do not believe in any of this. They do not believe in governance. They never voted for any of the things I just mentioned. So we have to be very cautious because this is not about incrementalism. This is about elimination because they don't believe in governance. That's why they even say they're not going to pay our employees who are not working now, but because they don't believe in what they do. It's a shame, a pity, and it is flies in the face of all that we have done for the people, for the children, for our country. We have an obligation as we sit before the flag, the vision of our founders about this great country and what it's about, and about what our obligation are to our troops who vote to make this country so great, and also our children for whom that we're here to protect. So understand this, when they make this, like a reporter said to me on TV this morning, well, they just want to make some improvements, reforms. I said, what reforms? 20 times at least, maybe 60, 70 times, they tried to repeal it. They weren't suggesting any reforms then. What reforms are we talking about? Well, they might have an idea. They might have an idea. Their idea is to give a $4 trillion tax break the wealthiest people in our country, tax to wealthy people and corporations at the expense of our children. And I declared there on that show this morning that Donald Trump is the worst president of the United States for children. And many of us are here for the children, but he's taking food out of their mouth to give tax breaks to the rich, removing their health care, talking in ridiculous terms about climate and clean air, clean water for our children. Forget about it. Gun safety, forget about it. Everything you can name, he has been a problem for the children. But we come to this point where we're talking about health care, which is a health issue. It's also a financial health issue. People can't afford all of this, especially now that they want to take away now, as you know, we passed the Affordable Care Act. We were not one Republican vote, but we did it because we had public sentiment with us to help us win the vote. Or the diagnosis groups, any diagnosis you could name was there helping us. We saved it because we had 10,000 events around the country for people to tell their story. And that's why this is so important today, to tell the story. Nothing more important. It's better than any provision of the bill you can name or any politics you can talk about or any motivation somebody may have, because it's the story of people and what the Affordable Care Act meant to them. But it's not just about the Affordable Care. It's about the Affordable Care Act. It's about Medicaid, which is contained in that. Medicare, which is contained in that. $600 billion from Medicare. Hundreds of billions of dollars from Medicaid. One that gets me the worst that I don't think they could possibly, maybe they don't understand that, but they do understand food for children. Hundreds of billions of dollars from SNAP. Hundreds of billions of dollars from SNAP. So their goal is to reduce any government participation in improving the lives of the American people. That's who they are. That's who they are. And they say it proudly. And then they say, oh, they should go to work. As soon as they go to work, they lose their ability to qualify for Medicaid. That's part of their thing. And they have their friends that they give tax breaks to who are hiring these people at low wages and sending them right to sign up for Medicaid. Sign right up for Medicaid. Again, adding to the cost to the taxpayer and subsidizing their low wages. So there's all kinds of sociological, economic things involved here that they are intricately involved in trying to hurt the American people. We had a story at our press event, we had many stories, but the one that I bring here. Cinnamon is a San Francisco native and a stay-at-home mom of 2 young boys. Last November, her husband was laid off and she immediately applied for Medi-Cal. That's Medi-Cal is Medicaid in California. Just weeks later, her 4-year-old son became dangerously ill. After multiple ER visits, he was admitted to the hospital for a life-threatening infection. He spent 3 weeks in the hospital, came home on 9 different medications, and is still under the care of 4 specialists doctors haven't ruled out autoimmune condition. Thanks to Medi-Cal, Cinnamon's family paid nothing. Without coverage, the hospital bill alone, over $300,000, would have bankrupted them. After 9 long months of job searching, her husband finally landed a position at a well-known tech company. Cinnamon breathed a sigh of relief, thinking her family was finally secure. But as a contingent worker, her husband doesn't get the same health benefits as regular employees. The family plan costs $200 a month, completely out of reach, and with this new income, they no longer qualify for Medicaid. They no longer qualify for Medi-Cal, California. This is the thing. Go to work, send her to work, but yeah, and then they don't qualify for Medicaid. They know that. This is why the Affordable Care Act healthcare tax credit matters so deeply. Without those tax credits, Cinnamon's family and thousands like her could lose coverage altogether. They've done everything right. They've worked hard, applied for coverage, made responsible choices, and yet without these subsidies, they could still fall through the cracks. No parent should ever have to wonder if their child's life depends on whether they can afford an insurance premium. Extending the tax credits means families like Cinnamon's can stay protected, continue to recover, and live without fear of financial ruin. Open enrollment for Marketplace begins in November. Plans need time to update premiums for next year, which is why Congress cannot afford to wait and must act now. And that's why we have to have a permanent solution to this. Families like Cinnamon's are counting on it. And we heard story after story when we heard the 10,000, we had the 10,000 meetings where people told their stories. My father had a stroke. My baby was born with a heart condition. My wife is suffering from breast cancer. The list goes on and on, very familiar to the American people. That is what is going to open up government, the stories of the American people. So thank you for raising the profile of all of this so that people will tell their stories as well as have us tell them here. Thank you, Madam Chair. Thank you, members of the committee.
Thank you, Madam Speaker. Next, former Chairwoman of the Congressional Black Caucus, Congresswoman Joyce Beatty.
Thank you, Madam Chair, and to the members of the Steering and Policy Committee. And let me also thank Leader Jeffries for convening us and having Democrats here doing our job.
That's right. Let's applaud that. Let's applaud that. Great.
I am here and am thankful for the opportunity to testify today on behalf of the families, seniors, and working people facing a healthcare crisis in this nation, and particularly in my 3rd congressional district, which I represent. I am a subcommittee ranking member on financial services and chair emerita of the Congressional Black Caucus. I'm here today because I have seen firsthand the impact of how economic and health insecurity go hand in hand. And I know the lapse of federal health care subsidies will leave millions of Americans at risk, including low-income families, seniors, and people of color who already face barriers to care. I want to share a story of Clara, a constituent who has multiple family members that rely on the Extended Affordable Care Act healthcare tax credits to afford the medications that they take to survive their chronic health conditions. If the premiums skyrocket, they will not have the support they need for those medications and their periodic medical appointments to monitor their conditions. Medicaid isn't a handout to be thrown away with budget cuts. It's a lifeline for people fighting to stay healthy and for the safety net providers like Heart of Ohio Family Center, who serves them in my district, which is a not-for-profit FQHC, a federally qualified health center, which serves individuals and communities that might otherwise lack access to healthcare services. Another perspective from my district comes from a medical expert, a physician and a state senator, Dr. Beth Liston, who speaks out loudly about lives being at risk And she also speaks out loudly against the Trump administration. She has gone on record saying, in Ohio, people are struggling. Close to 40% of children are covered by Medicaid and CHIP. Half of all babies delivered in Ohio are delivered through the Medicaid program. Our Medicaid expansion population are our highest users of mental health and addiction services at a time where we're battling suicides and overdoses. And let me finally conclude, like so many of the other members who have testified here today, and thank the Democrats for being here, for doing our job, for fighting for health care. And this is personal to me. As a former Dayton, Ohio Stillwater Hospital administrator, I watched children get the care that they needed, and they were able to do that because of affordable health care. Watching my mother in her last days before dying with cancer, watching the care that she received, and now thinking back today, what would have happened if we weren't fighting here to lower the costs, to save the cuts, and to save health care. And I think it's so important for us to know that we are in a shutdown, and we need to say it repeatedly because Republicans are in charge at the White House, in the Senate, and in the Congress. And it is their responsibility to fight for the American citizens, to fight for health care, and they are not doing their jobs. And because they will not join us to save the cuts, lower the costs, and fight for health care, we are in a shutdown. And it is so important that the American people know that they are lying to them. And where are they? They are not here, but Democrats are here fighting for the American people. So healthcare should not depend on your zip code, your race, or your income. And in my great state of Ohio, 460,000 individuals will lose health care due to the big ugly bill, and 32,000 of them live right there in my neighborhood, in my district. Democrats are fighting for you. We're fighting to save health care. No health care, no vote. Thank you, and I yield back.
Thank you so much, Congresswoman Beatty. Another former chair of the Congressional Black Caucus, Congressman Stephen Horsford from Nevada.
Thank you to Chairwoman Wasserman Schultz and to Chair Barragan and Chair Kelly and to the entire Steering and Policy Committee, as well as to Leader Jeffries for hosting this important hearing on the Republican-fueled healthcare crisis. It is not lost on me that I am sitting on the dais with history makers who helped to shepherd through the Affordable Care Act. And I would be remiss if I did not thank Speaker Emerita Pelosi for your leadership as the Speaker who passed the Affordable Care Act into law. And to my dear friend and former chair of the Black Caucus, Congresswoman Beatty, and all of the members who are speaking very clearly with purpose about why we are here. This budget impasse is about healthcare, which is, to me, a fundamental right, but it's also an economic imperative. And outside of housing, it is the single highest cost that a family has to cover, whether that's in copays or premiums, prescription drugs, and that's the point. But we're here, and our Republican colleagues are not. The sad truth is, we have a White House and a Republican conference, both here in the House and in the Senate, that haven't listened, that aren't aware, or honestly do not care about the American people's right to affordable, accessible health care. And I do want to thank Leader Jeffries and House Democrats for being here, for calling us back to do our job. I don't know where else we would be, but here during the 8th day of a Republican-caused shutdown in order to protect a fundamental right to health care. So I want to thank my members, all of us, for showing up, for standing up, for speaking up, and for fighting back, quite frankly, in this moment. We are here and we are ready to work, ready to negotiate, ready to deliver real relief to the American people. And the timing really couldn't be more critical. They keep saying we have time to deal with these enhanced premium tax credits. We're past time. November 1st marks the start of open enrollment for the next year, and letters of notification of premium increases are going out as we speak. In Nevada, families will sit down, log into their Nevada HealthLink account, and figure out how to protect their health and their budgets for the year ahead. Make no mistake, congressional Republicans know this. Speaker Johnson is betting that by giving his conference an extended vacation on the taxpayer's dime, I might add, that he can block a deal and let chaos do the work for him. Well, Republicans could have acted. They had a choice. They had a choice when we were debating these issues in the Ways and Means Committee. Their big, ugly betrayal of a bill that's now law not only provided permanent tax cuts to billionaires, permanent tax cuts to them that were not paid for, that adds $3.5 trillion to our federal debt. And now they say they don't have the time or the money to give tax relief to middle-class families to cover health care. To me, that is disrespect. You had the time to give it to your wealthy donors, but not to middle-class families. Well, when the House Ways and Means Committee majority came to Las Vegas to sell their scam of a bill, they barely let the public in the room. And that's why I'm thankful again to the staff and others who also are helping to make sure we're bringing this message to the people. If they had done that, they would have heard the truth from Nevadans in my district, including Raquel from North Las Vegas, who works at a local hospital and who shared with me that the Affordable Care Act has been a lifeline for her patients across Nevada. But she also warned that the big ugly law is threatening that progress, forcing her employer to cut her and her coworkers' hours by 20%. And Raquel said it best: if the Affordable Care Act is eliminated, we will all fail. Eva, also from North Las Vegas, shared the impossible challenge of caring for her aging parents while managing her own chronic illness. Her family simply can't afford higher insurance or prescription costs. Her words stuck with me. Call me crazy, but being able to do the little things because of access to health care makes life so much easier. Well, here we are. Republicans are causing a direct assault on healthcare, and they're making life harder and more expensive, while Democrats are fighting to expand access to healthcare and to make life more affordable. That's worth fighting for. And Richard shared a heartfelt plea to make the healthcare tax credits permanent. Without them, his premiums would soar 150%, up $1,800 a month. Think about that, $1,800 every single month. And now there's this narrative that they're trying to set that this is some type of hand-me-out. After they just gave the tax cuts to the billionaires, they can't provide tax relief, leveraging our tax code to support middle-class families to keep their health care. This is personal. Each of us has stories of constituents and our own lived experiences. I'm struggling with a family member right now who is managing through Medicare, Medicaid, and Social Security. This is real, and it's life and death. So I appreciate all of my colleagues and their impassioned work and pleas, and I urge Speaker Johnson call the Congress back into session, open the doors of the House, let the members of Congress do our jobs, swear in Adelita Grajova as the next member of the House of Representatives, and let us cancel the cuts, lower the cost, and protect healthcare for the American people. With that, I yield back.
Thank you so much. Well said. Thank you to all three of our esteemed panelists. And as you make your way from the table, I will ask Congresswoman Nikki Budzinski from Illinois, Congresswoman Betty McCollum from Minnesota, and Congresswoman Rosa DeLauro, my chairwoman of the Appropriations Committee from the great state of Connecticut, to have a seat at the table. As Congresswoman DeLauro takes her seat, she will be up first.
Thank you very much. What an honor it is for me to be here today. And I want to say a thank you to Steering and Policy for organizing this effort. What an opportunity for all of us to be able to talk about the issue that's mostly on people's mind today, and that's healthcare costs, but also to tell the stories of the people that we represent and to bring that narrative here and to get it out to the public. I represent Connecticut's 3rd Congressional District, and I'm here because of the cost of living has hit Connecticut hard, very hard. President Trump is making it worse. Cost of living is the biggest issue facing the people in the United States. People today live paycheck to paycheck in this nation. They're dealing with the high costs of groceries, housing, electricity, but healthcare, the cost of healthcare is one of the biggest household expenses that most Americans face. Medicaid, the Affordable Care Act are pillars that hold up our health insurance system for Americans who do not have insurance through their jobs. Without these programs, people are left vulnerable. Yes, they're left on their own. President Trump is trying to demolish those pillars. He has refused to extend the insurance premium subsidies for families. What do those subsidies do? They help them to purchase health insurance on the state exchanges. And that is the issue around this shutdown. Is that President Trump refuses to come to the table to negotiate about the healthcare crisis that he is responsible for in the cuts to Medicaid and to the premium subsidies. He will not negotiate. Democrats ready, willing, and able to negotiate. That is why he has shut down the government. On Monday, I held a roundtable with primary care physicians in my district. One doctor told me that as soon as next month, November, people will begin to stretch their prescriptions, skip refills, delay essential care. Another told me that over 40% of our children in our state are on Medicaid, and losing coverage for only half of those children would be devastating for us long term. Thanks to President Trump, premiums in Connecticut could rise dramatically by an average of 17%. Family of 4 with a household income of $130,000 could end up paying nearly $13,000 more for premiums. A family of 3 making $109,000 could see an $11,000 increase. And an older couple with an income of $85,000 could see their premiums increase by nearly $30,000 a year. These increases are completely unaffordable for families who are already living paycheck to paycheck. It is about the cost of living. How do people afford price hikes like this? I also held an event where I heard from individuals and family members of those living and working with disabilities under various Medicaid programs. Their stories were poignant and inspiring. Stories like Brianna and her son Maverick, who was born premature at 33 weeks and just under 3 pounds. They spent 30 days in the NICU. Then they were enrolled in Birth to 3, a state Medicaid funded program which provides wraparound support and information to parents of children with disabilities. The medical experts in Birth to 3 program gave Brianna tips on how to strengthen Maverick's neck and spine so that he could learn to crawl and he could learn to walk. They told her of how to navigate appointments with medical teams and help support him all the way through preschool. Karen, who uses MedConnect, a program that provides health insurance for employees with disabilities. Karen has learning disabilities, was institutionalized for 24 years. She worked hard to develop the skills to live independently, and she now lives alone, working 20 hours a week at a grocery store, learning a variety of positions. She earns too much to qualify for Medicaid, but MedConnect allows her to earn Medicaid benefits while working, covering her dental care and other essential health needs, making her independent. It is Chris, an adult living with a disability who was able to receive employment supports from Medicaid to spend time with an aide at the local library until he found a dishwashing job that could support him and allow him to live on his own, once again, becoming independent. These are the few of the powerful stories that I heard. I know that there are more like this in every state. If Connecticut is forced to make cuts to state programs due to the $1 trillion being cut from Medicaid in the big, beautiful bill, programs like Birth to 3 and others would be severely reduced or eliminated. And that is why Democrats are fighting so hard to extend the insurance premium subsidies. And we need to do it now, not in December, as Speaker Johnson has talked about. Why? Because in my state, the notices are going out October 20th of premiums and increases. November 1st is open enrollment, and the first payment that people need to make is on December 15th so that they can be covered by January 1st of next year. We are here. Where are our Republican colleagues? Don't make light of it, but where's Waldo? Where in the hell are they? They are on vacation. You know, police and fire are on the job. Capitol Police are on the job. You can talk to them, and we should say thank you to them for being here because they're not getting paid. They are being furloughed. Or they're going to be paid after the fact. Thanks to Democrats for addressing this issue and bringing it before the American people, because without the Democratic advocacy, the public would not understand the depth and the breadth of this healthcare crisis that is before them. Democrats are at the table. We are ready to negotiate, and the message is clear. Lower the costs, cancel the cuts, and save healthcare for the American people. Thank you for this opportunity, and thank you for doing this.
Thank you so much, Congresswoman DeLauro. Next up is my fellow appropriator, Congresswoman Betty McCollum from Minnesota.
Thank you, Madam Chair. I appreciate the opportunity to testify on the attacks of healthcare that my constituents are hearing about at the hands of the Trump administration and the Republicans of Congress. Let me be clear why we are here today. This is a Republican shutdown of the federal government. Democrats are here in Washington. We're ready to work. And yes, we are ready to negotiate. But the House Republicans, they're nowhere to be found. And that's because Speaker Johnson decided to cancel votes in the House. Now, why did he do that? Because Republicans have created a healthcare crisis and they don't feel the need to work with Democrats to fix it? All of this is happening, as has been pointed out by numerous speakers. Americans are experiencing sticker shock of the high, skyrocketing healthcare premiums that are coming via mail. I'd like to give a few examples of what Republican leadership has done to healthcare in this country. Their big, ugly law nearly cut $1 trillion from Medicaid. Let me say that again, $1 trillion cut to Medicaid. 15 million Americans are at risk of losing their coverage because of this law. In my state of Minnesota, that could be up to 140,000 people who will lose healthcare coverage. And yet the Republicans refuse to do anything about it. Republicans in Congress and the Trump administration have made so many cuts so quickly on so many fronts that it's difficult to keep track of the damage that they're doing. To understand the impacts of some of these changes, I have spent this year holding and attending town hall meetings to hear directly from my constituents on how they're being affected. My latest town hall included a wide range of expertise from providers, patients, and other professionals working in the healthcare sector. These experts came from all backgrounds, and they share the same concerns, identical concerns, how Americans will lose access to healthcare and how it will affect their future. The stress, the confusion, and the defeat being felt by Justin is just one example, and it's unacceptable. Let me tell you what Jason shared with me at our hearing. And these are his words. And I think he's speaking on behalf of 1.2 million of his fellow Minnesotans that rely on Medicaid to live their lives. Justin's a 27-year-old writer, blogger, and disability rights advocate living with cerebral palsy. And during our discussion through an adaptive technology, he shared the following with me, and I quote, "My life as I'm currently living, that I've worked so hard pulling together over the last 9 years, it feels like it could implode," end of quote. Medicaid alone is what pays for Justin's medical care, medical equipment, staffing, and more. This aid means that Justin can have things like a communicative device so he could speak at our meeting, a wheelchair that allows him to move comfortably throughout this world, an adaptive shower and toilet so he can live his life in dignity. And everything I just mentioned would cost Justin and his family up to $49,000 a month. Right now, these expenses are covered through Medicaid, and right now, they're all at risk. So what happens to Americans like Justice when this funding is just snatched away from them? They feel stress, they feel confusion. But it's not just Medicaid now that they have to worry about. The Republicans' shutdown has highlighted the cancellation of the affordable tax credits. 22 million Americans rely on the ACA tax credits to make their healthcare more affordable. So in Minnesota, that's 90,000 people who use these credits. And without them, they can start to expect to pay, on average, $180 more each month or $2,160 per year. And many will even pay more than that average. Minnesota families are telling me they just cannot afford this kind of increase. And that's why the ACA tax credits were canceled in order to make billionaires and corporations have a sweetheart deal on their taxes. Oh, and theirs were made permanent. So Democrats asked Republicans to join us in extending these tax credits in the legislation that we proposed. Thank you. My ranking member has a great piece of legislation to take care of and fix this. But instead, they're not showing up for work. They refuse to work with Democrats, and they are failing to keep the government open. The future of healthcare in our country is at risk. It's our national security, and it's our economic security and our personal security that's at risk. And that's why we as Democrats are standing here and asking our Republicans to join us to change the direction of what is happening to healthcare in this country. So I, along with my colleagues, we're ready to work. We're ready to negotiate. We just need Republicans to come to their senses and negotiate with us in good faith. Madam Chair, I yield back.
McCollum. Now, Congresswoman Nikki Baczynski, a second-term member from the great state of Illinois.
Thank you very much, Chairwoman Wasserman Schultz. And I want to thank Leader Jeffries and the Steering and Policy Committee for hosting this and to giving me an opportunity to lift up some of the voices of constituents that are deeply concerned about this Republican healthcare crisis that has been created. I want to highlight in particular two constituent stories from my district, specifically in Alton, Illinois, who will be impacted if the Affordable Care Act enhanced premium tax credits are allowed to expire on January 1st. Laura and Rick are a married couple in their early 40s, doing their best to make ends meet. Laura is self-employed and cleans homes across the community. Her clients have come to develop a trust with her over time, so she also helps with caregiving responsibilities. Rick is a carpenter who works long hours across the river in St. Louis, Missouri. Together, they have 3 kids, 2 grown in their 20s, and their youngest, an 18-year-old in high school, getting ready to start in community college. Over the past 4 years, Laura and Rick have relied on and enjoyed the ACA marketplace coverage. They currently pay a premium of about $300 per month, which allows them to access important medical screenings and lab work specific to the care that they need. Without the ACA enhanced premium tax credits, their premiums will jump up more than $810 per month, an increase of more than $500 every month for them. Coverage for the year would cost nearly $10,000. Laura told my office, and I quote, "We're already starting to have painful conversations about what we'll have to cut from our family budget. We may have to stop saving for retirement or pull from what little we've saved. We may have to give up the small family vacations that they're able to afford." A middle-class family like Rick and Laura shouldn't be terrified of what a single medical emergency would do to them or one of their loved ones. In Laura's words, it would bankrupt us. Those are her words. Laura and Rick currently help pay for dual credit college courses for their 18-year-old daughter, who is a senior at Alton Community High School. However, they are very concerned they will not be able to help put their daughter through college if they are forced off of their health insurance. Losing their tax credits not only threaten their health care, it would also put at risk their entire financial stability, their retirement, and their daughter's college aspirations. We cannot allow families like Laura's to lose their health care and force them to choose between their retirement and their daughter's education. We absolutely must extend the ACA tax credits in order to help families, everyday Americans like Laura's. And I would just say this is one story of many. I know in my district, we estimate about 17,000 families take advantage of these ACA tax credits. And so I hope that Republicans will get back to work, come to Washington, meet with us, negotiate on a bipartisan basis to provide this relief. This healthcare crisis is manufactured and of their own doing. And that's what we're simply asking to support the families like the ones that I'm so proud to represent in Central and Southern Illinois. So thank you so much, Chairwoman. I appreciate the opportunity.
Thank you so much, Congresswoman Bazinski, McCullum, and DeLauro. We appreciate your advocacy, and as they make themselves make their way from the table, I ask Congressman Jimmy Gomez from California, Congressman Gabe Amo from Rhode Island, and Congressman Herb Conaway from New Jersey to please join us at the witness table. Oh, I'm good. Thank you. Thank you, gentlemen, very much. We'll begin with the most senior member at the table, Congressman Jimmy Gomez. That's you. First time for everything.
So first, I just want to thank Leader Jeffries as well as the Steering Policy Committee for hosting this. This is an important thing to do, is continuously tell the story and the narrative of what's going on here in Congress. Republicans are AWOL, right? They have basically left their post, are not doing the job that they were sent here to do, which is to fight for their own constituents and for the American people. Even regardless if you disagree with us on issues, you should not be MIA. You should not be gone. And that's what they did. They're gone. And somebody asked me a question is like, why do you think that's the case? A reporter asked me, why do you think Mike Johnson? I said, in most other shutdowns, what did we see is that they would keep us here working, even if it's on other issues, they would be working to put pressure on the members, to put pressure on leadership, to put pressure on themselves to find a deal. So when Mike Johnson lets the Republicans go home, councils votes, maybe they're on vacation, maybe they're in the district, who knows where they're at? It's because he doesn't want to have that pressure here to reach an agreement that would be negotiated by all the parties involved. So he thinks that he can just by leverage and punishing federal workers, the American public, letting the ACA enhanced premiums expire, that he's going to get his way. That's what that's about is because he wants to once again rip away healthcare from the American people in order to give billions, if not trillions of dollars in tax breaks to the ultra wealthy and the largest corporations in this country. That's what it's about. We hear on the streets, we hear in the lobbying court that they're talking about another budget reconciliation bill. Why is that? To do more of the same, to do what they did on the one big beautiful bill that cut $1 trillion from Medicaid, that cut SNAP, all to give those permanent tax breaks to those individuals, the largest corporations and wealthiest individuals. That's what they want to do. And we know that the expiration of the ACA subsidies hurts everybody. And one of the things that I know is what it's like when you don't have health insurance. I grew up without health insurance. Most of my life, I didn't have health insurance until I was 25 years old. Think about that. So, and I know what parents do. When you get sick, if you have a child that gets sick or injured, you wait to see if they get better. And if they get better, well, lucky you didn't have to spend money, nothing's wrong with your child, and you live to fight another day, for lack of a better phrase. They live to fight another day. But that's not always the case. When I was about 7 years old, I got sick with pneumonia. This was in the middle of summer. My parents were waiting to see if I was getting better. They used home remedies, everything from Mexico that they can think of. I'm glad they didn't kill a chicken and rub it over my head or anything like that. But I got sick, went to the hospital, and because I had a 7-day stay in the hospital, my parents had to put up, this is what they did back in the day, put up the house as collateral. That's what they would do. Put up the house as collateral, and then you would have to make payments. You miss a payment, they take your house. So at the end of that year, I knew that we're in bad shape when my siblings blamed me for not getting Christmas presents that year. But we almost went bankrupt, but my parents managed to make it. And that was because they missed shifts from work to take care of me during that 1 week stay and those hospital bills. Families shouldn't have to make those kind of decisions. They shouldn't have to wait to see if a child or a family member gets better or worse before they get care. And then what happens when they don't have health care, they go to the emergency room. And that costs everybody more because they're required to be seen. So that's what's at stake. It's life or death for a lot of folks. People who are going to get treated or not treated. It means that 4 million Americans will just give up their health insurance. 20 million will have skyrocketing premium costs to an extent that it actually disproportionately going to impact Republican states that didn't expand Medicaid. Those 10 states that didn't expand Medicaid, a lot of their people went onto the exchanges. So they're going to have disproportionately impacts when those premiums skyrocket because these ACA subsidies expire. To an extent that Marjorie Taylor Greene even called this out and called out her own party. If Marjorie Taylor Greene is the voice of reason of the Republican Party, they are in trouble. They are in trouble. So that's what's at stake. It is life or death for people. It's about affordability. And the Republicans need to come back and do their jobs. And they, no matter what they say, no matter what they do, there's never been a time in history, except under Donald Trump, that a unified government under this president, it's Republican House, Republican Senate, a White House, that the government closes. It's usually in a divided government. As Steny pointed out, in the 80s, it was because the Democrats were in the House and the Senate was controlled by the Republicans. But they managed a deal in a matter of days. A matter of days, they cut a deal. So that shows you what this is about. This is about people fighting back. This is about the Republicans just want to continue their attack on working folks. And we have a constituent who sent me a few constituents. One constituent sent me a letter saying her premiums were going to go up 70%. Another one that used to pay $82 in premiums on the exchanges in California now is going to see an increase of $382 per month. So that's what we're dealing with. People can't afford that. You can't afford those kind of increases. And then with the tariffs that are impacting so many different families, the economy that's really not doing well, people are going to just give up their health care in order to survive, to pay the rent, to buy food, to take care of the other basic necessities. And like my family and like myself, you will risk to see if you get better or you get worse. With that, I yield back.
Congressman Gomez, and by just about a year, Congressman Gabe Amo is the next most senior from the great state of Rhode Island. Thank you.
Thank you, Madam Chair, and thank you to the Steering and Policy Committee and Leader Jeffries for ensuring that we reflect the voices of the people that we serve around this country, that we elevate their stories, that we highlight this Republican healthcare crisis and a Republican shutdown. You know, since congressional Republicans skipped town 19 days ago rather than release the Epstein files and help 22 million Americans, including 40,000 Rhode Islanders, afford their health insurance, I've talked with countless constituents at home about how Trump and congressional Republicans made a choice. They made a clear choice. They wanted shutdown and chaos over healthcare for their families. That is a very stark difference in priorities. And so as I moved around the district over the last several days, I met with lots of people. I met with cancer researchers and clinicians at the Lagaretta Cancer Center at Brown University who were affected by Trump's cuts to cancer research. Now, because of the Republican shutdown, cancer patients can't enroll in clinical trials. And I met with the men and women who answer calls from some of the most vulnerable Rhode Islanders seeking assistance with their basic needs at the United Ways of Rhode Island's 211 call center. Because of all we've heard with regard to both the pending healthcare challenges and the shutdown, they saw a 30% increase in calls on the first day of the shutdown. I met with Coast Guard members in Newport who are working hard to keep the waters around Rhode Island safe, the ocean state. But they aren't being paid because of the Republican decision to choose chaos and shutdown over reopening the government and healthcare. I met with families and advocates at the Northern Rhode Island Out of the Darkness Walk to Prevent Suicide, who are terrified that Rhode Islanders won't have access to the mental health care that they need if Trump and Republicans don't come to the table and extend these life-saving tax credits that help so many people in our communities access mental and behavioral health care. I met with leaders in the blind and low vision community at the 55th Annual National Federation of the Blind Convention to hear how critical Medicaid is to ensuring accessibility and the healthcare of this population. And just today, this morning, before I hopped on the plane to come here, I spoke with leaders and state officials at Children's Friend in Central Falls, Rhode Island, to highlight the importance of the special supplemental nutrition program for women, infants, and children that is being threatened by the Republican shutdown. And I know we might have seen something in the news to suggest that the president actually has some concern for women, infants, and children, but we can't take them at their word. We can never do so. And that's why I announced legislation to ensure the states get reimbursed for any shortfall in federal WIC funding caused by a government shutdown. And so I hope that we are able to, amidst this crisis that Republicans are causing, support our families. But, at the end of the day, this is about the values that we have about ensuring that everybody has access to affordable health care, and the Republican values of literally stealing billions from the American people to enrich corporations and the wealthiest Americans. And I think about one of my constituents who is enrolled in the Health Source Rhode Island marketplace, our state exchange, that is keeping her alive. The enhanced premium tax credits for Carla, who is of East Providence, Rhode Island, a great town. It's so important to her that she is able to get her health care through there because she's got a family history of hypertension, a family history of heart disease, and she's spent her career as a mental health counselor. So at age 60, she is in a position where, before she's on Medicare, is seeking out her health care through the exchange, and she is going to see her monthly premiums increase from $427 to $904, 112% increase. And she's going to try her hardest to keep her coverage because she needs it to stay alive. But she's thinking about food. She's thinking about housing. She's thinking about medication. And at the end of the day, something's got to give. She has limited options and she just wants to stay alive. And so that's the stakes. People will die. They will make choices that prohibit them from living their life to the fullest extent. And in fact, they will make choices that may harm their health, picking housing over prescription drugs one month, maybe switching to paying for health insurance. All of these interlocking challenges hurt us, hurt the healthcare system for everybody. And so just last week, the night before the shutdown took effect, I had a teletown hall with 17,000 Rhode Islanders who hopped on the phone. And to a person, every caller and participant spoke to their fears, but they also spoke to what they want their lawmakers to do and what they've seen out of Democrats and what maybe we can inspire Republicans to do, which is show up. They've seen Democrats show up. They want Democrats to keep fighting. And that's what we're going to do. And we're going to fight to stop the cuts. We're going to fight to lower the costs. We're going to fight to save healthcare. Republicans have to come back from vacation and get to the negotiating table because the people in their communities are struggling too. The people in their communities will suffer too. And ultimately, their inaction will destroy our healthcare system. It will jack up costs. It will make people poorer and sicker. Those are the stakes. And so I'm grateful to serve the people of the 1st Congressional District of Rhode Island, grateful to be alongside the great Democrats in this caucus who are fighting for their constituents, but we need Republicans to show up and do their jobs. And with that, I yield.
Much. And last but certainly not least, and we won't haze you as a freshman, Congressman, Dr. Lawyer Herb Conaway from New Jersey.
Well, I have to tell you, Madam Chair, it is when I left the Assembly in New Jersey, I was the second most senior person in that body, and now I'm really at the bottom of the heap here. But my name is, and thanks obviously to Leader Jeffries and the steering committee and your leadership and the leadership of Ms. Representative Kelly and Aragon for holding this very important forum, so that we might bring increased attention to this crisis in healthcare that the Republican Congress and the President is bringing to the American people. This is a manufactured crisis. I am, as you mentioned, a first-term congressperson. I'm also a practicing physician, and I've been at this working at policy for the last more than 25 years. It was my privilege as the chair of the National Conference of State Legislatures Health Committee to win the endorsement of the ACA as the ACA was coming into passage, and later was able to pass the New Jersey exchange that has allowed so many people to attain insurance for the first time. I understand all too well how important insurance is to health status. As people gain health insurance, the health status improves. This has been shown over and over again. And unfortunately, we have a party that, as we've heard here today, would rather see these programs wither on the vine. And they have, and it's interesting, and just highlighting as a corollary to what my colleague Gomez has said, it is interesting that while they control the entirety of the government, we've got this shutdown when that ordinarily happens in divided government, when you think there's going to be, when you know there's going to have to be negotiations across party. But here they control the entire thing, the entire government, and here they are not at work, while the American people are suffering under the uncertainty and the fear of what will happen as their health care is cut. The largest cut to health insurance and health access in the nation's history. Untold crisis, unnecessary crisis. And they spent the last 9 months of this administration doing nothing but raising the cost for working families across this country. Whether you talk about the tariffs, that are nothing but a sales tax on everything Americans buy, and the mismanagement of the economy, where now people across the world who are in the know, who have money, they're buying what? They're buying gold. When they used to put their money in the dollar, because that was a secure place to put your money. They're mismanaging the economy so much that now people are buying gold, and gold is through the roof. I just want to highlight a story and highlight a few things that are I think are very impactful and that the American people need to understand. I happened to have a Medicaid roundtable in my district a couple of months ago in the wake of the continuing resolution that came up in the spring. And I heard from constituents, regular folks who are on Medicaid. I heard from hospital administrators. I heard from people who are running nursing homes. And there was a story of a mother who came to speak about her child, who was born differently abled, but overcoming her challenges because of the ability of her family to access Medicaid for that child. Mom was able to go to work and continue providing for the family and keeping a roof over their head, and that child was able to progress through school, get into higher education, be able to have the medical support she needed to get through school, stay in school, and go on to higher education. Having the support to take up a part-time job while she was in school in a library, working there, and able to live independently in her home because of the support from the Medicaid program, which under these Republican cuts might very well be pulled away from them, and upending certainly the life of this young woman and a family who supports that child and her progress through life, totally upending their life. I heard from hospital administrators who were concerned about their ability to keep programs in place at that hospital because of the cuts to Medicaid. Hospitals get revenue from those who have private insurance, commercial insurance, people who are working or their employers are providing for their insurance. They get revenue from the Medicare program, now being cut to the tune of $536 billion by this Republican government. They get revenue from the Medicaid program, nearly $1 trillion cut by the Republicans in this government. Republicans who are not here working today. And so they wonder whether or not they can keep critical services going in their hospital. Not every service is a cardiac surgery service that makes money, or other cardiology services, but services that people need, pediatric services, birthing services. They're not high-end, high-dollar services, and we have seen over time that hospitals will often jettison those and other less profitable product lines just to keep the doors open and just to keep people employed. That's what they were facing. I heard from a nursing home administrator wondering whether or not they'll be able to keep the doors open of the nursing home, because what do they rely on? Where are seniors getting their care? People who have challenges in health. They're getting those in nursing homes where they need 24/7 care. I've worked in nursing homes. I've seen the conditions there, and certainly as a policymaker and as a health officer in my county, I have been involved in the nursing home issues in the nursing home. I understand what happens if now, when a nursing home closes. I've seen it. How to get people housed. What do families do? Do I have to come home from work? Do I have to take over for that 24/7 care that was being provided by the nursing home? These are the challenges that people are facing all over the country, and it doesn't have to be. And it's being manufactured again by the Republican Party, who here is not at work. And what's even worse, and sadly, is they're not here at work because of the Epstein files. They know when Representative Grijalva comes in, one of the first acts as a congresswoman will be to go in and sign that discharge petition, and then we will pass it. We have a bipartisan majority that will allow us to get those Epstein files back, and that is the last thing these Republicans want to deal with. A couple of additional points, and I'll yield back. I think it's important for people to understand that these disastrous cuts engendered by this big, cruel bill impacts everybody in the economy. It's not just a question about Democrats shilling for the poor and the dispossessed, shilling for the hard-pressed middle class. If you have insurance and you use that insurance to go to a hospital or to go to a nursing home, and the revenues to those institutions are cut by these cruel cuts, those institutions will either go out of business, or now you don't have a place to go if you need a nursing home. You don't have a hospital that might be near for you so that you can get emergency care if you need it. And indeed, you might be out of a job if those institutions close. And if you look at the closures that are occurring across the country, here in rural parts of the country, up in the northern Midwest, that's Trump country. These are people that voted for him, and it's not surprising that I guess Marjorie Taylor Greene, whatever she does, she reads polls, and she certainly understands the plight of her own children who are seeing their health premiums go up by 50%. Now, in New Jersey, 450,000 people are going to be impacted, and right now get a benefit on the exchange with the premium tax credits. 450,000 people in New Jersey. Medicaid impacts about 350,000 people in New Jersey. We go out for renewal here on November 1st. And as we know, these premium tax credits are going to end at the end of the year if we don't act, and these Republicans are not here acting with us to preserve those cuts. The average yearly cost of an individual in the exchange in New Jersey is going to go up by $1,200. The average cost for a family of four in New Jersey now on the exchange will go up by over $4,000. And this is on top of the increased expenses that come to families because of these ridiculous tariffs and this mismanagement of these people in the world. That's what they have brought to the American people. And this is right on the ground impacting regular folks, and it doesn't have to be. The Republicans get back in here and get to work. We can solve this crisis for the American people. And I want to take on one other thing, a couple other things. One, and I've already mentioned this, so I'll just bear repeated. When a hospital closes, when a nursing home closes, they're often the largest employers in their jurisdictions, and people are out of work.
Yep.
And that drives down local economy. And I want to take on a lie, a Republican lie that is just part and parcel of the same. We heard from the vice president. We've heard from Republicans that there are undocumented people sort of gaming the system and getting benefits under the Medicare and Medicaid program. That is an out and out lie. Undocumented individuals are not eligible to benefit under Medicare or Medicaid. Now, if you have an emergency, if you end up at an emergency room, no matter what you are, I'm a physician, we reach out with a helping hand. We don't ask people what your status is if you show up at the hospital. We don't say, are you a citizen? We don't say, do you have insurance or not? We reach out with a helping hand and we get you taken care of. And Ronald Reagan passed a law that said, if you show up in the hospital, your hospital, we're going to make you whole if you provide emergency treatment. So I just want the American people to know that they're lying about this question of whether or not undocumented persons in this country have access to these important programs. They do not. And so I urge Speaker Johnson, I urge my colleagues to come to Washington, join us here, and get back to work for the American people. Let's stop the cuts, let's lower the costs, and let's preserve and protect American health care.
Thank you so much to our panelists, and appreciate all the perseverance on behalf of our colleagues who are determined to make sure that we get the stories out about how impacted our constituents are. Our last panelists will be Congresswoman Mary Gay Scanlon of Pennsylvania and Congresswoman Lizzie Fletcher of great state of Texas. I am unclear. I think both the congresswomen have the same seniority, essentially elected in the same class. 6 weeks. Okay, well, I'll let you duke it out between you on who I call on, but Congresswoman Scanlon has been here for quite a while, so we'll start with you.
Thank you. Madam Chair, thank you so much. And thank you to all of our colleagues for convening this important hearing to help all of us and the American people understand what is at stake right now for Americans' healthcare. Across America, the Republican healthcare crisis is not an abstract policy debate. It's a daily reality for working families, for seniors, for small business owners who are being forced to choose between getting the medical care they need and paying for basic necessities like food or rent or childcare. In my own district, these challenges have been painfully real. The largest health system in my district recently went bankrupt, leaving a gaping hole in access to care for tens of thousands of my Delco constituents. Several other critical community health centers have been pushed to the brink of closure, fighting just to keep the lights on. And still other frontline hospitals and primary care centers are hanging by a thread. Institutions like these are lifelines. When an entire hospital system shuts down, families are left scrambling for care, and dedicated healthcare workers are left without jobs. But Republicans are pushing policies that would make this crisis even worse. When they passed their big ugly bill this summer, they prioritized giving trillions of dollars of tax cuts to their billionaire buddies while slashing Medicaid funding and refusing to extend the Affordable Care Act's enhanced premium tax credits that millions of Americans rely upon to afford healthcare coverage. In my district alone, 24,000 people are expected to lose their healthcare as a result. Without immediate action, premiums are going to skyrocket, making care even less affordable and pushing our remaining providers closer to collapse. If hospitals and clinics in my community could barely stay afloat before the big ugly bill slashed their Medicaid funding, how will they survive with rising unreimbursed healthcare costs? My constituents have been reaching out to share their experiences and concerns. Last week, a woman in her 60s called my office to report that she had recently received her ACA renewal notice, and her insurance costs would increase from $1,000 a month to $1,800 a month. If the ACA credits aren't extended, she's not going to be able to afford everyday expenses plus healthcare. Another small business owner who I met in a dog park over the weekend told me that until passage of the Affordable Care Act, he'd frequently gone without health insurance because he couldn't afford it. But now he has a family and he's afraid that without the Affordable Care Act credits, he won't be able to afford the premiums, which will put his entire family at risk. Even our Republican colleague, Marjorie Taylor Greene, is speaking out in support of the ACA subsidies, sharing that her adult children, their insurance premiums are going to double in 2026 if Congress doesn't extend the ACA tax credits. And we know what happens when people lose their coverage. When people get sick, they don't get better by not seeing the doctor. They get worse. They delay treatment until it's catastrophic. They rack up medical debt and risk losing their homes. We know that over 100 million Americans now have serious medical debt. And yes, people will die if they can't get timely health care. Republicans control the House, they control the Senate, and they control the White House. But they have decided they would rather shut down the government than negotiate with Democrats to find a solution to the healthcare crisis they've created so that millions of Americans don't lose their health insurance. So I want to thank my colleagues for holding today's hearing and standing together to make sure that American families can get the health care they deserve. I yield back.
And bringing us in for a landing, Congresswoman Lizzie Fletcher, who by maybe 6 or 8 weeks is also a member of the class of 2018.
Well, thank you so much, Chairwoman Wasserman Schultz, and thanks to you and the committee for holding this hearing today and for giving us the opportunity to talk about what we are seeing at home in our districts. I am glad to be here with you and with one of my favorite classmates who so beautifully and articulately expressed the vision from her district, which I am hearing in my own district in Houston. And I know that many of our colleagues have raised their concerns today about the Republicans' failure to extend the enhanced premium tax credits. In my home state of Texas, the cuts to Medicaid and the refusal to renew the expiring healthcare tax credits will mean hugely increased healthcare costs for all Texans, for every single person in our state, as they will for people across the country. It is estimated right now that Texas will have the highest loss of coverage of any state in the United States. If these tax credits expire, people in my community, like communities across the country, could face higher health insurance premiums, loss of health insurance coverage, delayed care, increased uncompensated care in our hospitals, and so much more. And many of the people that I represent have wanted to let people in Washington know how disastrous this will be for our community and for people across the country. And they have been coming to Capitol Hill for months and months since we were debating the big ugly bill, talking about how disastrous these policies are. And so I want to make sure that you hear from them today. And many of the people that I have the privilege of representing work in the Texas Medical Center, which is the largest medical center in the world. It is home to some of the greatest minds in medical research and medical care. It employs more than 100,000 people. It has 10 million patient encounters every single year and a GDP of $25 billion. Last month, the Texas medical institutions gathered together, as well as the Greater Houston Partnership, which represents the business community in our 12-county region in Houston and Harris County. And the medical center institutions sent letters to me and to every member of our congressional delegation, Republican and Democrat alike, outlining their concerns about the impact of the expiration of the premium tax credits and what it will mean for our community. And I would love to introduce the entire letter into the record of the hearing. And
Without
just-
objection.
Terrific. I would love to give this letter and just to share with you one example that they gave here of many. They said to every member of our delegation, the consequences of the tax credits expiring would be devastating. If Congress doesn't act, a Texas couple in their early 60s could see their annual premiums rise by more than $17,500, more than tripling their out-of-pocket costs and placing coverage out of reach. The affordability cliffs would lead to coverage losses, delayed care, worsening health outcomes for our patients, would be higher uncompensated care costs, overburdened emergency departments, and greater resource strain across our networks. And the Greater Houston Partnership, as I said, which represents the business community and leading institutions in our region, also sent a letter to our congressional delegation supporting extending the enhanced premium tax credits and pointing out that of the nearly 3.5 million residents in a variety of industries in our area, nearly 1/3 of those workers are able to remain healthy contributors to our economy because of their ability to access affordable healthcare coverage through enhanced premium tax credits. These tax credits have provided business owners and employees alike with much needed stability, empowering entrepreneurship and economic growth. And our partnership has asked us to make it a priority to extend these tax credits. What we know now is that the estimates are that more than 1 million Texans could lose their coverage without an extension of these credits. And in my district alone, it's estimated that 125,000 people will see their healthcare costs increase as a direct result of the failure to extend these credits. So it is critical that Texans and all Americans have access to affordable healthcare, and it is clear that the enhanced premium tax credits expiring will be devastating, not just for people in my district, not just for people in Texas, but for people all across the United States of America. There's so much at stake, and that's why it's so important that we're here. It's so important that our colleagues on the other side of the aisle return to Washington and work with us to address this crisis that we've heard from at home. Republicans and Democrats alike, voters and constituents are telling me that they want us to solve this problem. I'm glad that we as House Democrats are here working together to do that, and I thank you for the opportunity to share these stories with you today.
Thank you both so much for your feedback and input and advocacy on behalf of your constituents, and to all our colleagues who came today and our expert witnesses who we began this hearing with. We want to thank you all for showing up to work because that's a basic requirement that our constituents live every single day. It's a concept totally lost on our vacationing House Republican colleagues, however, and I want to thank you all for explaining how devastating this GOP healthcare crisis will be for the people that we represent. We hear their fears constantly in frantic phone calls that were detailed throughout this afternoon, emails, or just by walking down the grocery store aisle when we're doing our own food shopping. So thanks to all of my colleagues, and especially to our expert panelists from healthcare to small business and health policy experts for detailing this human toll. The stories that we heard of lost coverage and skyrocketing costs will have devastating real-life results. More delayed diagnoses, more costly healthcare access through our emergency rooms, more crushing medical debt, and tragically, too many lives needlessly lost. We know it's coming. Republicans already enacted the largest cut to Medicaid in American history, and all just to provide massive permanent tax breaks for their mega billionaire donors. And the breaking news from my state while we've been sitting here is that our deputy director of Medicaid just testified in front of our state legislature that Florida is set to lose $3.8 billion in Medicaid funds under the big ugly law. It is outrageous. Republicans refuse to extend the Affordable Care Act tax credits for middle-class Americans, and they are clearly more than willing to expand the mass suffering. Trump policies have already made life too expensive in America. Rent, utility, and food costs just keep climbing. Now Trump tariffs and a slumping job market are adding to everyone's anxiety. And yet by refusing to extend these Affordable Care Act tax credits, tens of millions of Americans across the country will see their premiums, copays, and deductibles shoot through the roof. And we heard colleagues tell real life stories. We're not just saying that that's what's going to happen. We have the evidence, and we brought that forward today. Americans don't need that added pain. Every single poll tells us that. They don't need another mega bill for the mega rich. So Republicans need to end their paid vacation, and they need to sit down with Democrats to negotiate a spending deal that prevents this healthcare crisis from exploding, and one that reopens our government. Notices of healthcare price hikes are going out to Americans right now. My constituents share them with me. They can go to my Facebook page. I posted one of those notices today. Even, as you heard, Marjorie Taylor Greene broke ranks and urged her Republican bosses to negotiate a solution to this crisis. And until that happens, House Democrats will continue to show up and do the work to cancel the cuts, lower costs, and save Americans' healthcare. Thank you all again. Democrats will keep working to solve this healthcare crisis that was manufactured by our Republican colleagues. With that, the Steering and Policy Committee of the House Democratic Caucus stands adjourned.